Natalie Barrett. I am a student of Wilmot Academy where I am pursuing a level 2 course in healthcare assistant. Today I will be doing a skin assessment along with a glaucoma test on a diabetic patient who is bedridden. Skin assessment is helps to evaluate health and also to detect local and synthetic diseases. It also gives important information about serious potential health. Diabetes. Diabetes mellitus, otherwise known as blood sugar, is a disease where the pancreas produces little or no insulin. A diabetic can be rated as a type 1 diabetic or a type 2. Type 1 diabetic mellitus is known as an insulin-dependent diabetic mellitus. It is an onset from youth. It can also be developed at any age. It can also be of hereditary infection or metabolism. Type 1 diabetes can be treated by direct exercise and insulin. A type 2 diabetes is a non-insulin dependent diabetes mellitus is a disease from the age of 40 onward. It can also be developed at any age group. A type 2 diabetes can be treated with exercise, oral medication, and some patients will require an insulin. The normal rate for blood sugar is between 4 and 6. If it is above 6, it is considered as hypoglycemia. Hypoglycemia is
Go.
normal diabetes reading is between 4 and 6. If the reading is above 6, it is considered as hyperglycemia, which can result in a diabetic coma. Hyperglycemia can be treated with electrolyte fluid and insulin. If the reading is below 4, it is considered as a hypoglycemia. It can lead to insulin shock. Treatment can be orange juice, milk, or just a candy bar. Diabetes mellitus is a disease that can be caused. Symptoms of diabetes mellitus are polyuria, excessive urine, polydipsia, excessive thirst, polyphagia, excessive hunger, blurred vision, itching and tingling of the feet, heart disease. Oh, God, stop. Symptoms of diabetes mellitus are polyuria, excessive urine, polydipsia. Signs and symptoms of diabetes mellitus are polyuria, excessive urine, polydipsia, excessive thirst, polyphagia, excessive hunger, blurred vision, skin condition, itching of the skin, slow healing of wounds and cuts. Illnesses associated with diabetes mellitus are neuropathy, disease of the nerves, nephropathy, disease of the kidney, retinopathy, disease of the eye, heart conditions, skin conditions, and foot problems. Now I'll be going ahead to do my hand washing procedure. Healthy diet and exercise is a key practice to reduce or keep your blood sugar at a normal rate. Now I'll go ahead and do my hand washing procedure. My hands. No water. Hand washing is very important in a healthcare facility as it eliminates germs and helps to break the chains of bacteria. Disposed. Journal for privacy. Hi, Miss Brown. How are you doing today?
I'm doing great.
Today, my patient is Miss. Today, my patient is Miss Naya Brown. Hi, Miss Brown. How are you doing?
I'm doing great.
I'm about to do a skin assessment on you. I'm only gonna touch you. Am I allowed to touch you?
Yes, ma'am.
Thank you. Now I'll start with the head. As I'll be inspecting for the lining of the head, breaking down of the scalp, any head bugs and head lice, the thickness, the texture, feeling for any lumps. Can you lift your head a little for me, ma'am? All is good. All is good. Now, I'll just eat off this glove. Put it in there. Sanitize the aqua base sanitizer. And go ahead and get a new gloves. Brown. I'm just gonna remove your mask a while. I'll be inspecting the skin, any redness, any breaking down of the skin. All is good. Skin is pretty good. Now I'll be inspecting the right here. See if there's any skin breakdown, any building up of wax. I'll check behind the ears. So this is an area which will be a little sweaty and can cause the breaking down of the skin. Could you turn to the right for me, please? I'll be inspecting the left ear. I'll be looking for the same thing, breaking down of the skin. I'll be inspecting behind the ear. Okay, I'll be inspecting the eyes. Is there any glaucoma? Any blood shots? Eyes are pretty. I'll be doing the same on the other eye. There's no glaucoma. There's no breaking down of the skin. I'm inspecting the nose. All is good. The lips. Okay, ma'am, could you open your mouth for me, please? I'm inspecting the teeth to see if there's any chips, any sharp edges of the tooth. Open them out a little wider for me, thank you. Okay, could you lift your tongue? Okay, could you stretch your tongue out for me, please, Miss Brown? Okay. Good, good. Could you say ha? That is good. Okay, could you close your mouth? Now we are going on to the neck. I'm looking for breaking down of the skin, any rashes, birthmarks, moles, all is good. Now I'll be inspecting your right arm. I'm going to ask you to lift your arm for me, please. I'll be checking the elbows and the shoulders. Okay. I'll be taking a towel. I'm gonna just pinch your skin a little. It won't be that hot. Pretty good. Let's take your nails between your fingers. All is good. I'm gonna pulsate your fingers. Just gonna squeeze your finger a little bit. Capillary refill. That is good. Now I'll be doing the left arm. And I'll be looking for the same thing now. I'll be stretching the elbows, shoulders, and the arm, the fingers. I'm going to pulsate your finger a little. Capillary refill, that's good. Okay, that is good. Something is wrong. Your chest. Start. Okay, down. I'm gonna just check your chest. It's important to check the places that normally have creases, because they will sweat and intend to be warm and moist, and then you will have skin breakdown. On this ground, I'm going to provide you with a privacy blanket. Can you hold it above you? Hold it, blanket, the sheet, towel for me, please. Okay. I'm going to go ahead and inspect your back. So I'm going to ask you, I'm going to place your hand across your chest. I'm going to lift your legs a little, and I want to turn you onto your right side. Good. And now I'm going to check your back. Okay. All is good. No breaking down of the skin. I'm going to check your inner thigh. Okay. All is good. All is good. Turn your back over. Thank you. I'm going to go ahead and inspect your legs. Okay. Go ahead. Are you feeling any pain? Is there itching or numbness in your feet? No. All is good. Okay, I'll go ahead and check between your toes. Your feet, I'm going to lift your legs a little. Your ankle, any pain? No. Okay, all is well. All is well. Okay. I'm going to go ahead and check the other foot. Okay. Good. All is well. There's no breaking down of the skin. There's no acne. There's no ingrown toenails. That is good. These are perfectly good. There's no breaking down. Okay, Miss Brown. I'm gonna go ahead. Place it. Remove the privacy blanket. Okay, I'm gonna go ahead and perform your glaucoma test. Okay, I'm gonna use a finger. I'm gonna use the alcohol swab. Clean it. Okay. of it. Now I'm gonna it's my lancet. Okay. Okay, it's not gonna be hot, you're just gonna feel a little pinch. Wow, that's good. Thank you. I'm use a little dry cotton. I'm gonna ask you to hold this cotton on it for me, please. Wow, your reading is 5.3, Miss Brown. It's pretty good. I'm gonna dispose of the handset. I'm gonna. Okay, Miss Brown, are you comfortable? Can I get you anything else before I go?
Okay.
You are? Okay, let me get you back, you settle in. Okay. I'm gonna leave you with a caller button in case you need anything. Just press the buzzer and I'll be right with you. Place your mask back on. Now I'm gonna go ahead and clean up my ear.